You need to know globally what it can give, and that gives you a first idea. And what are the main actions of thyroid hormones? Well, first of all, the thyroid hormones, they work on the body all over, almost every tissue. They increase the blood volume by about 20 to 30% more, and also the speed of the blood movement. That means that there's more blood everywhere, there's more nutrition everywhere for the tissues. And they open up the capillaries. I have many studies on the heart with the hormones, and most of the hormones can open up all the capillaries around the heart, for example, but also in other tissues. So that gives more blood, water, oxygen, and nutrients to the tissues. So very major hormones. The most important hormone to stimulate the blood circulation. Don't you see in the streets here? Maybe some here are also like this. And you just need to take thyroid hormones at the adequate dose, and it's over, and it's okay. Now, when you take it, there's only 2% going in the thyroid gland. 20% goes in the skin, 32% goes in the body muscles, and 35% in the body fat. Iodine can, for example, you can totally reverse breast cysts with putting iodine on the skin. It takes a year and a half, but even if you have recluse disease, the severe form of cyst goes away. I also add progesterone, that helps also. But iodine is really interesting as an intern. I take iodine every day. It took out my heart arrhythmia that I had after having an accident with the vaccine of the COVID. I was crazy enough to take it one day. 2 to 4 years of iodine nation of municipal water increased the T4 45%, the TSH was 40% decrease, and there was 90% scourge prevalence in Italian northeast of Italy. Suppose it must be in the mountains, because there was not enough iodine in the water. But they introduced iodine in the water, and they had better thyroid function. So Ligol, 5% is the optimal solution. 1-2 drops a day it's a high amount, but it's completely safe. And then Iodoral, these are tablets that you can have 12.5 milligrams. In Belgium, we have capsules of potassium iodide, very safe. So dose is half to 1 tablet of Iodoral. And now, unfortunately, iodine really works to help the thyroid function up to age 3. But that's iodine that is not on the form of Ligol solution. So Ligol is a better form of solution. So you have this cretinism here, and the young children, less than 4 years, when they received iodine, reversed their hypothyroidism. So cretinism is a severe form of hypothyroidism. And you see this swollen face, swollen eyelids, and older children, partially successful, but after age 14, it doesn't seem to work. I think there's some efficacy with Iodoral, the potassium iodide. So this is just iodized oil, but it should be probably a Ligol solution. Okay, so in summary, the nutritional supplements can improve the thyroid function. There are more. This is an extract of a much larger list. Iron, selenium, copper, vitamin A, inositol, sufficient iodine, and avoid high iodine because too much iodine can block thyroid function. It blocks the secretion of T4. Now, I don't find it so true anymore, but for example, in a woman who has a pregnancy, this is the only treatment you can give normally. You don't give anti-thyroid medication. You give high dose of iodine, you give up to 50 drops, between 20 and 50 drops of Ligol, which is an enormous solution, but it doesn't harm. And the baby is then safer than with anti-thyroid medication. And these are based on old studies of 1940s, 1950s. What about this autoimmune thyroiditis that people have more and more? And maybe there's inflammation, okay, but Hashimoto's is much more frequent in women. most frequent autoimmune thyroid disorder. It affects 10% of women and only 2% of men. It could be because they have low androgen levels, because androgen secretes autoimmune disease. And thyroid autoimmune disease in general, 5 to 6% of the population, and it's growing. And the major cause is probably nutritional deficits if you don't think on the inflammation and the dietary problems. And the nutrients that can help are selenium, vitamin D3, iron, iodine, omega-3, supplements, zinc, and copper and probiotics can also be helpful in studies. But I'll talk about the major one. Vitamin D3, in patients with Hashimoto's disease, they had 22% lower serum vitamin D. And that can be sufficient to give a problem. Here again, a study showing that patients with autoimmune had 32% more risk of having vitamin D3 deficiency. And here's a study with patients with Hashimoto's disease, 85% had vitamin D deficiency. And the lower the serum, and this testosterone deficient, so it looks normal, but not much muscle. And hesitates a lot, not determined, not firm enough. So it's not only the body that is less firm in testosterone deficient, but also the mind. And so testosterone deficient, you see this change, testosterone, improved testosterone. And they even can get better. But basically this is the target there in the middle. I have written a book on testosterone Pro. It actually indicates that there's at least in 4 years a hormone deficiency that is defined. So, but it's never too late. When you give it, it's rectified, but it takes 1 year, 1.5 years to recover eyebrows. Okay? That's good. Then, look here, and the eyes are a little dry. The light doesn't reflect well. That's typical for low estrogen. So look in the eyes, ask your neighbor maybe to look into your eyes, like this, and you have the head may not move, but you look sideways, and to see if there's dryness or not. And you look like that.
You have high estrogen.
Yeah, I don't have an estrogen problem.
Yeah, and then you say to your neighbor if there's little small folds, it could be dehydration. Do you drink enough water?
Not today, not yesterday, but I tried.
If it was permanent, little folds, there's lack of water in the skin, it's due to vasopressin deficiency. And when you have vasopressin deficiency, when you drink water, you have to go quickly to the bathroom, urinate large volume. Do you have that? Okay, so she doesn't need any Botox, huh? She just needs vasopressin.
Oh.
Are you taking it? Somebody recording?
Yes,
oh, yeah,
of course.
So vasopressin, 50 micrograms in the morning sublingual, 100 micrograms in the evening, and then you will see, you will rejuvenate your skin because it's there's no skin folds. And okay, keep your water further. Still good in you, but you can make the face firmer. That's one of the things. Then can you swallow? I feel a little bit the thyroid very slightly enlarged. It can be an iodine deficiency or a thyroid deficiency because that reverses in 6 months to 1 year with thyroid. But it's very slightly, a little irregular. That will be normalized. So the So you always start low, and if they tolerate better, you can increase the dose to get adequate dosing. But I have that in the pharmacies here, but it's on the prescription. It's not dangerous, there's no side effects. Normally no side effects, known at least, whatever the dose is. So the thymus is here, and that is atrophied in adults. And so you don't make enough, certainly in older age, not enough thymus at all. And so what are the signs of alpha-1 deficiency? Well, signs of infection, tired look appearance because you're infected. And inflammation of all types is a potent anti-inflammatory hormone. So how do you see inflammation in a person? the two conjunctiva are inflamed. Look into your eyes and this evening, it's too inflamed.